Well, thanks so much for being with us, Doctor.
Thank you for having me.
It's a staggering number, Doctor, especially since a lot of experts believe it's a severe undercount. But doing the math with the numbers we have, the 6 million, it means 1 out of every 1,300 people around the world has died from COVID-19 since the start of this pandemic 2 years ago. So how does the death rate in this country, the U.S., compare?
So yes, indeed. Staggering is unfortunately a good word for it. And the US has reported more COVID-19 deaths than any other country. In fact, it's about 960,000. And CDC actually estimates that this death toll may be, the death toll actually may be 32% higher than what is reported.
Okay. Well, Dr. Tandon, as you know, thankfully, COVID numbers are declining. They have been for weeks now. And we're starting to hear public health officials use the word endemic more frequently. So how is an endemic different from a pandemic?
So that's the main question on everybody's mind these days. And pandemic is a widespread infectious disease over a whole country or the world at a particular time, as we saw with COVID-19. When enough people get infected, either through natural, or when enough people get immunity, either through natural infection or via vaccination, it tends to go towards an endemic. So though an endemic is a constant presence of the virus in the community, it differs from a pandemic because it's not that disruptive. It's not as widespread. It can be better contained. And it's not spreading out of control, unlike a pandemic causing stress on the healthcare structure. And therefore we can more easily prevent it and treat it. Just like the flu virus has now become an endemic, and we think that COVID is headed that way now, fortunately.
Well, speaking of the flu, let's get to a couple of questions from viewers. The first one comes from Rita, and she wants to know, is the flu season over? It is still only March here, but what do you say, Doctor?
So that's a great question, Rita. We have seen a drop in the flu cases. In fact, in Massachusetts, it's 0.6% influenza-like illness presentations to the hospitals now, which is a drop from the regional baseline of 2%. Hospitalizations have dropped too. And this is where I think the community came together. Everybody did the right thing with hand washing, sanitizing, staying home when you're sick, not sending your children to school when they're sick. And masking has helped tremendously. So definitely there has been a decrease in the flu rate, and hopefully we're at the tail end of it now.
Oh, we hope so. Any good news we'll take. Yes. Here's another question, this time from Jake, who asks, can you get infected by the same variant twice?
Yes, that's another great question. It is certainly possible. In fact, just this week, scientists have confirmed that there's a new subvariant of Omicron, which is BA.2, which is more contagious and can affect people who have previously had Omicron. Curiously, it hasn't caused any major second waves or surges so far. And it's definitely, we are actually continuing to see a drop in the COVID case rate. So it is not driving the infections up.
All right. Dr. Tandon with Mount Auburn Hospital. Doctor, thanks so much for your time.
Thank you for having me.